The appearance, composition, and timing of bowel movements are reliable windows into overall health. But how do you know what counts as irregularity across these domains? Nutritionist and naturopath Sheridan Genrich joins Vital Signs to break down what healthy digestion actually looks like and what your body may be trying to tell you when things are off. From the Rome 4 diagnostic criteria to the Bristol Stool Chart, we'll explore how to read the signs of digestive health, what diet and lifestyle factors drive irregularity in both directions, and when symptoms warrant a closer look. We'll also consider if less frequent bowel movements are ever compatible with good health, or is regularity always something to aim for? Whether you're dealing with constipation, loose stools, or just want to understand your digestion better, this talk will offer practical guidance on diet, supplements, and lifestyle changes that can make a real difference. Welcome to Vital Signs. I'm Brendan Fallon. Sheridan, great to have you join us on Vital Signs again.
Thanks for having me, Brandon.
Now, a lot of people may assume that if they miss a day without having a bowel motion that they're constipated, but there's this Rome 4 diagnostic criteria that I recently learned about, and there's a number of things that are looked at, and I think it's something like 3 days or something without a bowel motion is one of the criteria that is needed, and you need 2 of these criteria for it to be classed as constipation. But I wonder, even if someone isn't technically constipated, is there still room for concern, would you say?
Yes, it's actually a more complicated issue than just finding a technical term or putting a name on your condition. Because if the quality of your bowel movement isn't actually what they call complete, it's that feeling of emptiness, then this is where a lot of people can feel uncomfortable and like the quality isn't there, even if it's once every 2 days. So I think it's probably like, yes, there are diagnostic criteria, but I'm more interested usually in the quality of someone's life and the quality of their everyday movement. So when I talk about constipation, it's looking at, yes, the stool formation, and if it's obviously too loose, that's one concern. And if it's changed from what you've been used to for years, that's usually something that a clinician will try and dig and ask information to find out what's going on, because it's the change. And so, yeah, the constipation name is just one starting point, but it's really how they think about it and how they approach it, that they either have power or they stay stuck, literally. And it's not such a glamorous topic. So these people don't talk about this usually with their friends or their family. And a lot of people suffer in silence until they end up in a really serious situation with their doctor. And it's really one of the simplest ways to indicate health. So if people can think the quality of their bowel movements is connected to the quality of their brain function, as well as the quality of their overall long-term health, it's a good starting point.
Well, that's intriguing to hear that it's connected to the brain function. Can you give a snapshot of what you mean by that?
A lot of people these days rush, and one of the traditional approaches was allowing time in your morning to have a morning ritual that gave you space to sit and relax. Because, for example, if we oversleep and we're running out the door, we need coffee. I know a lot of patients that have told me they need coffee to have a bowel movement. That's a bit of a red flag to me, because starting the day with something like warm water is a really traditional way. The body doesn't work so hard as it would with cold water, and it's giving the intestines, after resting all night, giving the intestines some stimulation to start moving. And then the second part is the nervous system. And that's where the brain is very much involved. You've talked a lot with other experts about the autonomic nervous system. We have rest and digest, which is the parasympathetic system, and then fight and flight, which is the sympathetic nervous system. So when we are not in that rest and digest phase, our digestion is compromised. And we're not supposed to be stuck in one or the other all the time, but going into and out of those phases throughout the day is very normal. So our body won't let go emotionally or physically when we're holding on to tension and we're sensing danger. And that could just be from reading emails in the morning.
Right. Yeah, it makes sense. And I remember you commenting before that even animals in the wild will not defecate, and they won't eat if they've got danger signals activating in their brains.
Mm.
In terms of how digestion works, how does diet as one factor lead to someone being constipated?
Well, diet, hydration, and movement are really the cornerstones of action, and where there's going to be some gaps that people usually can start with improving. Diet, everyone talks about fiber, but sometimes the types of fiber that people are eating, if it's a high fiber breakfast cereal that they're having that's heavily processed, it's not the quality of fiber that's going to allow toxins to be drawn out of the liver then into the bowels. I used to talk with my patients a visual diagram. It's called the funnel of it's the funnel of, let me just bring it up, the drainage funnel. And this is something from Ayurveda and Chinese medicine. And at the bottom is the colon, but then above that you've got the liver and the bile ducts, and then the lymphatic system. So, for example, just having a lot of fiber, it might fill someone up and give them a sensation, but they're not really eliminating toxins from the body. And so the food that they eat can change the way and quality of their bowel movements very much.
Okay, so they might be eating fiber and still having a significant bowel movement, but maybe the toxins aren't actually being removed that need to be removed from the body. Was that something that they could gauge by the look of their stool?
Yes, and the feeling within their lower abdomen. So the first thing is really to tune in to that feeling. If someone needs a very, very long time to go to have a number two, then you're going to really notice that, well, that's kind of not normal. And we see it with children. Usually, if you're trying to leave the house and they're in there too long, that's the time that someone's sitting on the toilet is really key, that they've got some issues with constipation. And there's two little things too, like the hydration. It might just need stool might need softening, or it could be that the bowels won't evacuate and release. So that's why something like just stimulating it may be that it's too dry. So they might be really lacking in hydration. For other people, they might be sitting too long at their desks and not getting any physical activity, and that will also lead to constipation. So they might not be drinking enough water, not getting enough physical movement, and so the gases and the food is putrefying in the small intestine. Then that releases bacteria that can actually harm the kidneys. So there's a lot more to, but really the key is like water, movement, and diet. They're the foundations usually, and they're talked about across many, many modalities.
Okay, so if someone is taking care of their diet fairly well, if they're getting an adequate amount of fiber, if they're hydrating themselves and they're getting a reasonable amount of movement, and they're still experiencing constipation, where would they look to then?
Yes, so hard stools, straining, pain, infrequent bloating, all those things are definitely going to be signs that it's not functioning as it should be. It's not normal. It might be normal for that person, but it's not healthy. Then they could look to either supplementation like magnesium. Magnesium glycinate is one of my favorites, magnesium oxide, if someone's really constipated. Then there's herbal medicines as well that can stimulate but not overstimulate. They're usually the starting point because I'm a nutritionist and a naturopath, but medical doctors would often look at stool softeners or laxatives as other alternatives. The only thing is, with staying on a laxative long term, it can actually make, I wish there was a better term for it, make your bowel a bit lazy. So it's not actually going to put in the muscular contractions on its own if it gets used to a drug. So laxatives can be useful short term, but again, they might not help someone that has dryness in the bowel, because the dryness can actually cause pain when they use laxatives. So it's a little more complicated. Starting natural is a safer, more comfortable way, but it really depends how long someone's been constipated for and what other things they're trying. I love the Ayurvedic approach, which is to use cooked vegetables, cooked food, less raw, and adding spices to your food that make it easier for digestion as well. Things like fennel seeds, cinnamon, cumin. These are ways to prepare the foods that make it easier for the body to digest, and it works in complete harmony with the rest of the digestive tract. And the other one is the cooked apple. That's one of my favorites too.
I'm sure prunes factor in there somewhere as well. I want to get more information about that side a little bit later, Sheridan, the supplements and the specific diet things that can be helpful. Before that, there's this very interesting diagram, the Bristol Stool Chart, that has these very obvious diagrams where people can, or doctors can look at stool and gauge it according to this chart. And we'll when we publish this, we'll have that diagram come up. What counts as constipation according to this chart?
When the chart's shown, it's type 1, which is what I think I used to have a kid's chart. It was rabbit droppings. So that was what it visually looks like little pebbles. So it's dry and not a lot of volume in bulk. Then from memory, it's number 3 and 4 are what they say is the ideal. But I rarely hear people talk about having a well-formed sausage, which is what 3 and 4 are. Especially people that are eating less food than they used to in the past, they'll notice their bowel volume change as well. So changing your diet doesn't always mean that you get a lot more bulk out of your stool. So 3 and 4, and even if the sausages are smaller, that's and if you're, depending on the size of your body too, a small lady is going to have a smaller sausage than someone that's really a much bigger person. So right. Keeping it in context is really important, and looking at your own hand is probably a good sign. But it's, and then the other one on the other end you probably want to know about is the Bristol number 5 and 6, I think it is. It's where it's way too loose, and neither extreme, at a 1, rabbit droppings, or towards, I think they called it porridge. It's they're neither. And I think I like to lighten this up for people when they're talking about their bowel movements, because it shouldn't just be something that is just avoided, because it's a big problem.
I think it's probably more of a thing of Western culture to be very sensitive or polite around this particular issue. Maybe there's other cultures around the world where they speak more openly about these things, and to some benefit. The carnivore diet is incredibly popular at the moment, and many people are trying this and reporting better health on the carnivore diet, better overall health. And I've heard people on this diet often say that their bowel motion has become less regular since starting the diet, and it's not necessarily like once a day. It might be significantly less than that. Can someone, would you say, be having a bowel motion less than once a day and still be healthy?
Oh yes, especially if they are more prone to going every 2 days. When it comes to, the ideal, there's been research done on this. Even I've found a good study in 2025 that the ideal was 1 to 2. They did it on, I can pull up the study, but it was in the University of Washington. that they looked at about 1,400 people that were already healthy, no signs of liver and kidney damage, and what they self-reported were with the number of bowel movements they were having. So between the most ideal was 1 to 2 a day. So if someone is still having a smaller volume and they're on a carnivore diet and experiencing a lot of the other benefits, but having 1 to 2 small movements a day, then to me that's a good sign. It's more than just the bowel movements that they will experience benefits from, reducing processed foods, especially if someone's active. If they're not active and they're on the carnivore diet, it can tend to be worse for constipation.
Well, I think a lot of people on carnivore are reporting like, maybe 2 days or 3 days only having one bowel movement within that span of time.
Yeah, and if they've got puffiness in their face, or if they've got joint inflammation, I mean, really, we look at the whole picture,
Right.
rather than saying, oh, my bowels are less frequent, this diet doesn't work for me. I'd be taking other things into context. And you can't, I say, switch to a diet, the good quality diet, and then not drink water or not get enough sleep. Or not try and walk around at least once a day. So yeah, but it's a good. I'm an advocate for not necessarily extreme diets, but personalizing it and people experimenting for themselves in a safe, realistic way with new foods, and it's a unprocessed diet. So there's a lot of benefits from eating good quality meat, which humans are designed to do.
One thing that comes to mind, and I'm sure people watching this might be wondering about, is I know the Bristol Stool Chart that we went through describing the Constitution. What about color in general? What can be learned based on color?
Yeah, it's a great question actually, because color if it's too pale and yellow, usually one of the things I ask about is how much dairy someone is eating, and that is a really key sign that, I mean, dairy is mucus producing, so it can affect the color of the stool in a big way. A lot of cheese, a lot of ice cream, like a lot of too much in excess can make the stools loose, because the stool should be a mid-brown. The liver is what, the bile production in the liver is what makes the stool brown. So liver health is also indicated in someone's stool and what comes out. So the mid-brown is ideal. If it's black, someone may be on iron supplementation. That's something I usually ask. And then the other one is, sometimes lack of hydration with darker stools. But some people also in the health sphere end up having a green tinge as well. So, but that usually is if they've got a lot of green cooked veggies and things like that. So the stool will indicate, well, like they say, you are what you eat. And it's really indicated in checking in what's coming out. Yeah.
So we've talked a bit about how poor nutrition and different lifestyle factors may lead to irregular bowel movements. What can cause what you might call the opposite problem of having, I guess, loose stool, like diarrhea or frequent loose stools?
So food poisoning is one obvious one. It should be short term. Chronic diarrhea is much harder to identify. It usually requires much more testing. Small intestinal bacterial overgrowth is one cause of chronic diarrhea, but it's also only one type of SIBO, as they say. That's the acronym for it. The other could just be, just poor diet and really heavily processed foods, cheese, medications. If someone's changed the medication and then the bowel movements change. That would be something I'd try and connect the dots between. Then also even medical conditions, like newly surfacing medical conditions can also change the bowel movements. So yeah, definitely a change in regularity and consistency and color. That's something they really should seek medical help for and not ignore it as just being uncomfortable.
Right. Anything, something out of the ordinary across those domains is worth getting examination done. Which was going to be my next question. Would you add anything to that in terms of when someone should seek like a formal examination?
I think tracking. So before seeking, like one of the first things someone could do is track for 3 days after they've eaten a certain food. And I used to have a symptom diary. So they call it a food, mood, poop diary. Just a simple piece of paper. You could put it in notes in your phone, and just becoming aware of, oh, I only went a little bit, or I didn't go this whole day. Because I'm so surprised these days at how many people just don't know what their body is telling them. It's like we're walking heads. We go from one meeting to another and the body's just chagging along. So tuning in is really where I would say, yeah, like that is the first place, and then not ignoring something to go and seek help. Because pain with a bowel movement can also lead to that feeling of, oh, I'm too afraid to go, which is again where the brain comes in and says, oh, I'm at work or I'm in a public toilet. It's not comfortable, but really ignoring the nature's signals can create a long-term mental habit of just being unsafe. And then that can cause anxiety, and they're very much connected, constipation and anxiety. So it may not always be that the bowels are the first thing that someone's going to pay attention to, but yeah, and the gut brain is always worth exploring from one end or the other.
Yes, the goings on of the brain obviously influence the gut, and what's happening in the gut is increasingly being discovered to have a profound impact on what happens in the brain. I'm interested to know, with your patients, the people that you've given advice to and guidance to, what has come through as the most common cause of constipation in those situations?
Hormone changes. I've worked with a lot of menopausal or perimenopausal women, and that is known. The hormone changes affect the liver function because they're fluctuating, and the liver is the detoxification of all our hormones, and that then can affect the bile flow and then the hydration, and then that can cause the bowels to just like not be eliminating as well. The other one used to see was people that came with reflux, and they would actually, because I'd seen this pattern before, their bowel frequency wasn't good, but their reflux was also very, very painful, and they actually had small intestinal bacterial overgrowth. And the reason that's connected is because putrefaction of protein in the small intestine releases gases. So eating a lot of protein and it not having that Goldilocks effect, the right amount of time to sit in the small intestine, it can basically go off and then release gases that cause system-wide damage. So it could be kidney damage, could be more constipation, but it's actually where the long-term health is connected to the bowel health as well. So to not think that, yeah, constipation is just lacking water. It's not quite that simple.
And that's related to SIBO, what you were just describing, the small intestinal bacterial overgrowth.
Yes. Oh, the other one too is hypothyroidism. So low thyroid function can cause constipation. And yeah, the medications are very, very much, because they all affect the liver. all of the medications that someone takes are being detoxified in the liver, and many of them can make, their already existing constipation, it can make it worse.
Right. So for people watching at home, if they're having symptoms along the lines of what we've been talking about, they might want to look into those conditions like the SIBO, hypothyroidism, and maybe consult their healthcare provider or their doctor in terms of that, or seek their advice in terms of that. As a nutritionist and a naturopath, how do you begin to help someone if they're experiencing problems in terms of their bowel movements?
I think the morning is the best time to start making small changes. So first of all, giving yourself enough space, 15 minutes extra in the morning than what you really like to. Even if you're a bit tired, then still give yourself more space in the morning. Starting the day with warm water, just a half a glass or some warm water, and that gets the intestines to start activating and working. Then if they don't want to make too many other changes, at least doing those steps before they have coffee is a good place to start. And then obviously the time that they've allowed, maybe their bowels will start to say, oh, we're not in danger, we can be doing this and we're fine. And also the overthinking can, creep in the morning if they haven't got enough time and they're rushing in their day, and that will affect them holding on in the morning to go to the bathroom. So those would be the places to start. The other one I've had really good success with is putting like either cooked apple, like stewed apple. It could even be done in the air fryer the night before, or boiled, and then just with a little bit of water. Softened apple is much more dry, hydrating than a dry cooked apple. And it's an Ayurvedic technique. They've actually even shown there's particular bacteria that benefit the gut in the cooked apple. And there's pectin as well, which we know is good for the gut. And then eating that, just one apple cooked the night before, try that. The other one could be chia pudding as well. Chia seeds are known to help bulk the stool, but the danger is people don't always soak them. So it's very important that people have chia seeds that are soaked, because otherwise that drying effect will happen in the bowel.
Yeah, I heard that they can actually be lethal if they're taken without moistening them.
Yes. If you're already dry and it's going to cramp someone,
Yeah.
make them very bloated, and they might think, well, this is a health product, what's going on? But it's just because they need to be soaked at least 15 minutes or the night before. And I have better success with people having them just a tablespoon. So start small, because otherwise too much fiber can also make someone feel worse. So just a tablespoon in half a cup of water, mix it up the night before, and maybe at dinner time, and then have it just before they go to bed. It can help while the nervous system is resting to bulk the stool overnight. And then in the morning, see if they have a bowel movement, or if it's not that morning, the next day, because the transit time varies. It's anywhere from 16 hours, that's the average. It's supposed to be working at 16 hours. So you eat something here, roughly 16 hours, should be less, but yeah, but it will get the soothing happening, so that the slipperiness of the chia seeds, it's like putting on a moisturizer on your outside skin. It coats and soothes the internal lining of the gastrointestinal tract. And there's other demulcents, they call them in herbal medicine, like slippery elm powder is also another demulcent that is very soothing for the throat and all the way through.
How the one that you just described, slippery
elm powder,
is that a generally available supplement? How much would someone want to start taking of that to see if it has an effect?
Yeah, I've used it more successfully than psyllium husk, which is another one a health food store might have. They're both usually available because they've been used by naturopaths and foodies for a very long time. And usually just like a teaspoon or a tablespoon, because any of these really strong things that absorb and hold on to water, they can have quite a powerful effect if they're overdosed, if they're taken in excess. And so a slippery elm tea is something people could just look up online, and having a warm water the night before with some slippery elm powder. I prefer the powders, but people can also get them as supplements, like a capsule. If they don't want to take powders and do the work themselves, they could just take a couple of capsules. And it's just, again, that coating in the intestinal tract can just be relieved, and that can maybe give that sensation of the bowels being able to relax and contract in a more normal way, especially if someone's been taking laxatives quite often. Then it's a way to get the body just back to normal. Yeah.
And what about the age-old grandmother remedy of prunes?
They do work. Prunes, I had to be careful recommending because patients with SIBO, they can't have excessive sugars in their diet. So I had to look very low sugar solutions. So if someone's just starting out on finding out constipation relief, then prune juice, just in a very small amount, can be useful. They work in a different way than what regular soluble fiber does. So it's this combination of fiber types that is very successful. If we only rely on one thing, then the body tends to try and compensate in another way. And that's where things go wrong, because we haven't really just got variety in the types of fiber we're eating. Yeah, so but prunes don't hurt usually.
What other changes beyond supplements and dietary changes may be useful to ease constipation?
Gosh, so I've mentioned movement. I think even someone that's very busy with work, not to underestimate, say, stretching and being able to take a phone call while standing up and walking around, because movement creates movement. And to not feel like they have to only go to the gym 2 or 3 times a week to be doing that for their bowel health. It's really daily movement, and small frequent bursts is better than just one big marathon on the weekend. And then, gosh, meditation. How could I forget that one? That is really powerful for calming the nervous system. And that is going to be a very good way to let go, not only physically, but emotionally and mentally, of the stresses that the body is holding on to, that we tend to only focus on the physical side in Western health. But it's actually connected to, patterns even that they've been learned as in childhood or through their family members. It's letting go is really something that meditation and creates a safety response for the body as well. So that is one that even Ayurvedas have been recommending for thousands of years for bowel health as well. And Chinese medicine has always seen the interconnection with the emotions and the physical side of the body in traditional Chinese medicine too.
Yeah, obviously, yeah, very important. And again, coming back to the association between the brain and the mind and what's happening in the body, and specifically the bowel movements. I've also heard that there are certain squatting movements that can be helpful, I guess, in the moment if someone is facing constipation. Is there anything like that you're aware of that someone could try if they're dealing with this?
Yeah. Yes, absolutely. There's stools that people can, they've talked about the standard toilet seat these days not being what our ancestors were used to. They used to know to squat. And if we go to Asian countries, they still squat on the side of the road, not for bowel movements, but just to learn to stretch their muscles and their legs. And that helps. Yeah, it's just a really regular thing, that squatting is very, very good for that muscular contraction. But these stools, you bring up a really good point, because what they do is elevate your feet, and then it creates the spine position that is more aligned with what the colon naturally, where it wants to sit. And that positioning is can be very good for just creating that ease of passage. Not if someone's dry though, and that's where you can try these things, but if the thing that is causing the constipation or the uncomfortable or infrequent, it's not always easy to identify with just like changing a position. So, but it'll be a good place to start.
Yeah, I imagine. I think recently this has been trending, this identification that many Westerners, or the majority of Westerners, aren't able to squat the way that many people from Asian cultures are, because they're just not executing that movement, and specifically in using the restroom. So as you're saying, a stool could help to substitute for that situation. And just lastly, Sheridan, I'm interested to know, I think we've touched on this a little bit, but overall, what other aspects of health may show an improvement if someone is able to stabilize their bowel movement?
The first one would be mental clarity, focus, even peace and joy, like their mood. I had some patients that had been suffering with constipation, and then I'd try magnesium. I think I mentioned that a little earlier, but a supplement with a really high quality, safely absorbed magnesium. So it wasn't creating a laxative effect, but it was gently stimulating that nervous system response. Then they'd send me messages like, oh my goodness, I'm so happy. So happiness in the day being connected to having a good bowel movement. Like, there's just so many benefits to being able to restart and just have an approach where you actually feel like you have a little choice in your day, and it's very simple. It's only bringing benefits in health when people get good bowel function. So mood, focus, anxiety relief, sleep quality should be getting better as well, because it's connected to the nervous system. And then thinking more long term in how this can help their lifestyle to be more active, because it creates a cycle. It's a feed forward cycle where the more active someone is, the more happier they are, and then their bowel movements and their health are a benefit as well. But the biggest one I was surprised to learn about was how damaging poor bowel health is for the kidneys, and because they sit above, like in the body, the bowels, and then the kidneys sit above, and they're connected in Chinese medicine to longevity. And kidney health, it's filtering all the toxins and the hydration. It's really important. And when we're not evacuating and we're not having good bowel movements, the food is sitting there too long and it's putrefying, creating harmful gases that affect these other organs. And I'm sure there's even going to more research that I haven't even seen yet about the heart, and it's connected to everything, because we can't isolate one area of the body and pretend the rest of the body's not listening.
Yeah, and what you were saying about the morning, I think it's a fantastic way to start the day with a win. Having a good bowel motion sets you up for a positive experience for the whole day. Thank you very much, Sheridan, for illuminating just how much this is connected to overall health, and some great practical guidance on how people can improve their bowel motion for better overall health, and when they might want to start looking for a more formal diagnosis, examination, and opinion on what they're dealing with. Look forward to speaking to you again soon.
Well, thank you for being able to have these challenging questions. It's a really important thing to highlight. So I've been happy to talk about it with you.
Thank you very much. And thank you for watching, everyone. This live episode of Vital Signs. You can find other recent titles, my interview with Dr. Russell Blaylock, a neurosurgeon, talking about the different nutrients that can improve mitochondrial health, to improve the body's energy, and even play a role in preventing Alzheimer's disease. Great to be with you. I'm Brendan Fallon. This is Vital Signs.